Hello, my name is Vivian Fonseca. I'm professor of medicine at Tulane University in New Orleans, and I want to talk to you about the ORIGIN study, particularly the results of the omega-3 part of the trial. As you know, epidemiological and post-hoc or secondary endpoint analyses of a variety of studies have suggested that the use of omega-3 fatty acids may prevent cardiovascular events in patients with a recent myocardial infarction or those with heart failure. Their effects in patients with diabetes or at risk for diabetes in terms of both primary and secondary prevention of cardiovascular events is unknown. However, since some omega-3 fatty acids are available over the counter and prescription medications in this class lower plasma triglycerides effectively, supplementation with omega-3 fatty acids is widely used by the general public and by clinicians. In the outcome reduction with an initial glargine intervention trial, also known as ORIGIN, a double-blind study with a 2x2 factorial design was used. The results of the comparison of insulin, glargine, and standard care are reported separately. Investigators randomly assigned 12,536 patients who had high risk for cardiovascular events and had impaired fasting glucose, impaired glucose tolerance, or diabetes to receive a 1-gram capsule containing at least 900 milligrams of ethyl esters of omega-3 fatty acids or placebo daily. The primary outcome was death from cardiovascular causes. The study enrolled patients at high risk of cardiovascular events with either a previous event or multiple risk factors. However, the median plasma triglyceride concentration was not very high, and patients were not selected specifically for this risk factor reduction. During the trial, risk factor reduction was very good with very well-controlled glucose, blood pressure, and lipids. Plasma triglyceride levels were reduced by 14.5 milligrams per deciliter, or 0.16 millimoles per liter, more among patients receiving omega-3 fatty acids than among those receiving placebo. The p-value was highly significant, without a significant effect on other lipids. During a median follow-up of 6.2 years, the incidence of the primary outcome of hard cardiovascular events, including myocardial infarction, stroke, or death, was not significantly decreased among patients receiving omega-3 fatty acids as compared to those receiving placebo. 574 patients, or 9.1%, versus 581 patients, or 9.3%, respectively, for omega-3 fatty acids or placebo. Thus, the hazard ratio was 0.98, with a 95% confidence interval of 0.87 to 1.10, which was not statistically significant. The use of omega-3 fatty acids also had no significant effects versus placebo on the rates of a number of other endpoints, including major vascular events, which occurred in 1,034 patients, or 16.5%, compared on omega-3 versus 1,017 patients, or 16.3%, with placebo, with a hazard ratio of 1.01 and 95% confidence intervals of 0.93 to 1.1. Or death from any cause, which occurred in 15%, or 951 patients on omega-3 and 964 patients, or 15.4%, on placebo, with a hazard ratio of 0.98. Or death from arrhythmia, which occurred in 288 patients on omega-3 and versus 259 patients on placebo, with a hazard ratio of 1.1, which again was not significant. Adverse effects were similar in the two groups. Thus, daily supplementation with 1 gram of omega-3 fatty acids did not reduce the rate of cardiovascular events in patients with early diabetes who had high risk for cardiovascular events. These results challenge previous concepts of the use of such fatty acid supplementation. Obviously, the results may not apply to other patients groups, such as those without diabetes or those with later stages of diabetes who do not have good control of other risk factors and or are unable to tolerate drugs like statins or ACE inhibitors, which were extensively and effectively used in this trial. In particular, it does not specifically tell us what the outcome would be in patients who had a markedly elevated triglyceride level at enrollment. A more targeted, personalized approach to risk factor reduction may be effective, but was not tested in this trial. These results may help us educate our patients on the futility of adding over-the-counter medications like these supplements in the hope of added benefit, in the absence of data supporting their use. Although they appear harmless, they add to treatment complexity and increase patient costs. The study also demonstrates little, if any, value in aggressive triglyceride reduction when other risk factors are well controlled and the patients are taking statin drugs, a result that has also been demonstrated in other recent clinical trials such as ACCORD and AIM-HIGH. Thank you.